Hi, welcome to Dr. Lisa Sulsenti's podcast. I'm Dr. Lisa, and today we're going to be talking about mold in your health, what you need to know. If you go back a few episodes, I think it's 2 episodes, I do introduce mold a little bit. We're talking about a patient, I believe it was a 2-year-old, and that's a really interesting mold case. So if you want to go back, listen to that podcast because you really can hear about the case, what happened to her, and how we handled that. So I wanted to go a little further because I happen to be getting a lot of these cases in the office lately. And when I start seeing the same case over and over, I'm like, okay, I think we need to talk about this because it's relevant right now. So this is a topic that I think also is often overlooked, misunderstood, and sometimes even dismissed in the conventional medicine. And I know it's a tough one in the medical world because I have really close people in my life that are medical doctors, and we've had this conversation together where they're just like, it's just not something that we consider. It's not something we really understand fully or know how to test, but it's definitely something that they feel is a possibility, like something they should consider. When we do testing, we do what's called differential diagnosing. Chiropractors do it, functional medicine practitioners do it. I believe the nursing field would do it, and I know the medical field does it. And what you're doing is you're looking at a person's history, either in front of you, you take a really good history, and you're also really listening to them in front of you, you're looking at them. So based upon what you see, what you hear, what you're being told, and then you might physically, examine them. So what your objectives are, what your subjectiveness is, and what they're being told, you are going to look at what you think the top 5 things are, wrong with somebody. And that's when you start playing detective work, is you're going to rule out these things. You're trying to rule out the top 5. And so you might want, out of the 5, your top 3 might be the worst case scenario. And you want to rule those out, right? And then you get down to maybe what you think it is. Testing helps you confirm some of these things. Mold isn't often considered in the differential diagnosis, is what some of my medical friends were telling me. So it's one of those things that maybe should be considered, but they just don't really know what to do with it. So that's what I was like telling them, these cases. And it's usually the thing where they can't figure out what the heck is wrong. And it can have a profound impact on health. And because I see it frequently in my functional medicine practice, I've been getting better and better and better and better at it over years, because that's the thing. When you start seeing something and you start treating it or managing it, I should say, I don't like the word treat, but we're really managing it with the patient. And then you see what works and what doesn't work. You get really good at it. And that's why someone gets good at something, because they're doing it over and over and over again. Many people struggle for years with unexplained symptoms, and mold can never be considered the root cause, right, medically speaking. And today I want to walk you through what mold is, how it affects the body, the types of mold we test for in functional medicine, why conventional medicine often misses it, why is this one of those things. And I'm also going to talk about a little bit about the testing that I use, the management approach that we use. It's an educational episode. It's not used for medical advice at all, but my goal is to empower you with knowledge so you can ask the right questions and possibly go in the right direction here. So mold's a type of fungus. It grows in damp, humid environments, right? So where there's water, there's usually mold. It can be found indoors and outdoors, but indoor mold is what concerns us most from a health perspective. So usually in your home or your office, or it could be like a school. So it's usually what we see in those 3 buildings, mold exposure, somewhere where you are all the time and you're constantly being exposed to it on a chronic basis. Colleges, dorms, right? I've seen it. That my one way I know about this is I experienced it with my children. So the dorm rooms, the air conditioning units that go in the windows, so apartments, living spaces, workspaces, and school would have to be considered, a space for kids too, because they're going there every day, and that's like a workspace. Mold reproduces by releasing spores into the air. And this is the sucky part of it. It's reproducing and putting things into the air, so you can't always see it. And you're breathing it in, you're inhaling it. And these spores can be absorbed through the skin and ingested, but also inhaled. Some molds produce toxins called mycotoxins, which can disrupt many systems of the body. And this is the part that I have learned always in the process of learning. I will be the first, if you know me, I do not know everything. Things change. We learn all the time. Some molds produce a toxin, and they call it a mycotoxin. And these things can really be disruptive to the body. So that's what functional medicine works deeply with, these mycotoxins. Common indoor mold sources are water damage, homes, basements, bathrooms, the HVAC system, leaky roofs, leaky pipes in the walls. That's a big one that I found. And even floors, like floorboards and floods and things like that. Any kind of water damaged thing that you might not see it. That's the thing. What, Dr. Lisa, where's the most common place? Just get to it. The most common place is basements and in the walls, which is not a fun part, and bathrooms. So if you're in the bathroom, there's always water, right? So you want to check that. If you see mold in the shower and things like that, you've got to stay on top of that stuff too. But what we have found in a few of our patients was the wall of the bathrooms, there's bedrooms usually on the other side. So someone sleeping in that bedroom could be inhaling mold spores. No mold, you don't see it in the bedroom. So you're like, oh, this room's fine. But it could be in the wall of a pipe that slowly has a slow leak. So leaking pipes is another big source. You don't always see it. That's the problem. Sometimes it's hidden in the walls, under the floors, inside the air ducts, and you can be exposed for years without realizing it. And you have to think workplace as well with this. Okay, types of molds, mycotoxins. This is getting really, really big. It's a huge topic. I don't have 20 minutes for this. I mean, I need more than 20 minutes for this. So I'm going to really summarize it as best I can for you. So in functional medicine, and if you're in the medical world, this will be interesting for you to learn, we often look beyond the basic mold panel. So I've seen people come in the office where the medical doctor did order it, but it's usually, and this is a very limited ability for them to test. This is just the way it is. Functional goes much further. So you have to understand, like I said in the last podcast, when we're trying to collaborate medical doctors, they're limited to what they can order. Functional medicine isn't limited because most of us are paying cash in functional. We're not using insurance companies. The medical model in America is based completely on insurance companies. So they're very limited. Their mold panel is usually quite small. So I do have patients that come to me and said, nope, we tested mold, it's not there. And I look at the panel, they tested 4 things. I need more than 20 minutes to go into all the different types of molds that are out there and then their toxins that they release. So we just know that functional medicine goes way deep. If you're doing a mycotoxin test with us, you're covered. Believe we can't find it, it's most likely you're good. In general, there's aflatoxins, and that's usually associated with liver stress, immune effects. And there's ochratoxins, which are usually kidneys, brain, immune systems. There's the trichothecines, which actually are the ones that are more like the black mold. And they are typically neurological, inflammatory, brain fog. We call that the sick building syndrome, when someone gets really sick. And it's a lot of it could be brain fog, memory loss, neurological, tremors. They could just be chronic fatigue. They can't get out of bed. This is really a big one. And there's lots of them in the trichothecines or cynines family. So when I'm mentioning one, there's a bunch of toxins underneath each one of these. These are just like the main category. There's gliotoxins, which are more immunosuppressive, and they're linked to like immune system dysfunction. So chronic infection, someone that keeps they're just not well. They chronically have, infection markers coming up and not getting well. They just can't get well. That one could be one. There is a category called the zearalenone, and they're disrupting hormones. So a lot of these can have the estrogenic effect, meaning estrogen's high, testosterone's high, estrogen's low, hormone problems. Thyroid is driven a lot of time by mold. So we got hormone issues, we got neurological issues, we got immune issues, we've got brain, we've got also rashes that don't go away, rashes that are not unexplained, rashes that keep coming back, that you want to think mold as well. So these toxins can accumulate in the body, and especially difficult for people to eliminate them if they don't have detoxification pathways working well. So here's the tick where we're going to get into MTHFR is a genetic mutation. I've mentioned it a lot. I've got podcasts on it in the last seasons or two. Please go back. I have a whole series on MTHFR. If you have this genetic mutation, your detoxification pathways and your ability to methylate things, which is really convert things into a safe form to eliminate them, can be at risk, can be struggling. And if you're struggling with detoxifying toxins and getting rid of them, you can have an issue with mold, right? So mold is something that we're all kind of exposed to. It's in foods as well. It's in a lot of some of the like coffees. It's in like, sometimes you'll see it on the onions. You can see it in corn, on the field. You'll see mold, right? Mold does grow in the vegetable field, right? In the garden. And so you can get it that way. You can get it through food. You can get it through actually these water damaged buildings and stuff like that. But you could have 4 people living in the same house, right? And one person is down for the count and so sick. And usually when they come to me, they're like, we have tried everything. We can't figure this out. They have done every test, MRI, CAT scans. They've done everything they can. We can't figure it out. And I run the mold panel and boom, it's high. And obviously this, let's say 15-year-old is living in a house with 3 other people. So they're all being exposed to it, right? When you look at the family and you're like, you're all good? They're like, yeah, we're good. Why is that? And that's the thing about functional. You got to ask yourself, why? Why would 4 people in a home with mold and 1 is really sick? Now, it could be that their room, I had a patient that the office the room she worked in, her office, she was the only one that used that room, happened to be in the wall in that room. So it could be something like that, but it's still getting probably in the ventilation system, right? Because these get into the air. So everyone's being in the house exposed to it. Here's the deal. Some people are what we call allergic to it. They just super, super respond in a negative way. And they can have a detoxification system. There's different ways of detoxification in their body. It's not just the liver, where it's just not working well and the body isn't eliminating it well. Here's the deal. The garbage center is the liver and the gut and the kidneys. These are where these centers are super important for you. And what they do is they take something that can be toxic, right? And it converts it to a safe thing. So something that's not safe, that has to get eliminated in the body, it converts it to something safe, water soluble usually, and it'll get sent to the gut and the kidney to be peed out or pooped out. Now, here's the tricky part. The gut is another garbage center. So it receives what the liver says, hey, you know what? I converted this thing. It's all good. You need to get rid of it. And for some reason, when we don't have healthy guts, some livers don't eliminate it. They recirculate it back into the body, back into the bloodstream. And estrogen is a big example of this. So is cholesterol. Even though we're talking about mold, some things get recirculated back into the body, and the medical world will go, we don't know why the estrogen's high. We don't know why you have cholesterol, but here's the drug to lower it. Functional is like, let's just get down to the root cause. Why is cholesterol being recirculated, not eliminated? Why is estrogen being recirculated, not eliminated? Why is this person not getting rid of mold while the other 3 people in their family have? So gut issue. Get down to the nitty gritty and get the gut working better. These mold and these mycotoxins, they can affect nearly every system of the body. So they can trigger chronic inflammation. If you're dealing with inflammation and you're taking medications for it, that's fine if that's the route you want to go. But if you want to know what's the root cause of my inflammation, it could be mold. Immune system dysregulation, autoimmune disorders, again, Hashimoto's we've talked about on our podcast. It's a big one. Could be mold, fibromyalgia, chronic fatigue syndrome, rheumatoid arthritis, things like that, right? Celiac, Crohn's, all these autoimmune type things that are just chronic going. Neurological symptoms like brain fog, headaches, dizziness, mood changes. Moody is a big thing with mold. Respiratory, here's another one. Sinus congestion, asthma, chronic cough, little cough, that cough you can't get rid of. I don't know why they have that cough, the phlegm. Because you're inhaling mold, it likes to think of the sinus cavity. So these chronic sinus problems, these chronic allergy problems, and everyone's telling you it's, I'm not saying pollen isn't bad, but pollen isn't out all the time. So if you're having chronic sinus problems, chronic migraines, chronic things like that up in the head, eye, ears, nose, throat, mold gets inhaled, right? Asthma, wheezing, coughing. And also, there is a possibility for these spores to live in you. So they'll find that moist crevices like the sinus cavities and they can live in there. So there is the possibility that it's within you. Hormonal disruption, big with mold. So we talked about thyroid, but definitely PCOS, infertility, high estrogen, low estrogen, high testosterone, low testosterone, so hormone problems. Gut dysfunction and increased intestinal permeability. So the thing about mold, it's quite interesting. I never really find it by itself. And I always thought, what is this? So when I deal with kids on the spectrum, I never really find one thing wrong with those kids. The kids that are really, really have high ADD, high ADHD. If I have a kid, because kids are young, their bodies, their tissues are as pure, as healthy as possible. So when kids come to me, I typically don't find just one thing wrong with the kids. I don't. I find multiple things. The systems are kind of really struggling, and it's not one problem. So when I deal with the kids, if I find candida, I usually find something else. Mold happens to be one of those things that I see across the board. This same thing, the same pattern I've seen with kids. I see mold with like kids and adults. Mold doesn't tend to be by itself. So it's really one of those functional medicine questions where you're like, all right, is the mold causing the parasite in the gut? Is it causing the gut dysbiosis? Is it causing the leaky gut? Or is the gut not functioning properly where it's not eliminating the mold correctly? I tend to think it's the second. I tend to always just go to the gut, and my goal as a functional medicine practitioner is where I'm very different from a lot of functional medicine people. I'm not crazy about the supplements. I'm not here to give you 12 supplements. I'm not here to just dump supplements down your body. That's literally treating symptoms. So I'm not doing that. What my goal is to get that gut to be working properly, to be as healthy as I can get it, and so it's eliminating what the liver sends it. We also want the liver to work properly. So you have to go a little bit deeper again with some of these genetic things that are going on, support the systems. But the most thing here with mold, the most impact you can have is say, before I try to remove mold, what else is in the gut? Is there a parasite in there? Is there candida yeast overgrowth? Because that's more fungus. That's more mold, right? Kind of yeast is its own little fungus. Is there bacteria in there? Is there a virus in there? And this is is there heavy metals? And I want to challenge you here in my thinking, because if the person has mold, you can pretty much be, 100%, 99% sure their gut is not eliminating toxins, right? Why? That's why they have mold. So that's going to make you say, okay, if the gut and the liver are not eliminating toxins, then they're probably going to have heavy metals. They're probably going to have another bacteria in there. So that's why I see multiple things together. And that's why I see it with the ASD kids. Their guts are so messed up. They're not detoxifying. They're not getting rid of things. So when I look at kids with autism spectrum disorders, they are so hyper and can't pay attention, and their brains can't function because their guts are so messed up. So it really is about gut health when it comes to these things, and mold is a big thing. We talked about chronic fatigue with mold. So you have to ask yourself, how do you treat it? What do you do? How do you manage it? Because if it's a leaky gut thing, we will get to that. I just want to give you some common symptoms of mold exposure: chronic fatigue, brain fog, memory loss, headaches, migraines, sinus congestion, chronic sinus infections, chronic cough, asthma-like symptoms, but it's not asthma. Or it could be, you could have asthma as well. Joint and muscle pain, hormone imbalances, digestive issues, all of them. Food sensitivities, mood changes, anxiety, depression, skin rashes, and unexplained sensitivities. Light, the rashes are a big thing too. I see rashes with mold. If you feel worse in certain buildings and better when you're away from home, that can be an important clue. So you don't feel good when you're home. You get out in the fresh air, you go out with your friends, you feel great. If you go to work and you feel crappy, you come home and you feel better, that's a sign. We do see a lot in the workplace, unfortunately. Testing. So in my practice, we have a really thorough mycotoxin mold testing. It's a urine-based test that looks for multiple mycotoxins in the body. So it's looking for the toxins that these molds give off. The testing can help identify whether mold exposure is contributing to the symptom and should we include it in the management plan. If it comes back negative, it's a big win because you just don't have to do anything and you don't have to worry. So you just check off the box mark and go, whew, okay, it's not that. Again, I have to stress here, our testing is different from the medical world because they just aren't allowed to go as in depth here. And that I know for a fact because I have a best friend that works in the billing department in insurance companies. I've got plenty of, I don't want to pinpoint anybody, but I know several people that very close to me that work in billing for insurance companies and for hospitals. And I have some really very wonderful people in my life that are nurses and medical doctors, and they talk to me about this. The testing is very limited for them. This is why functional medicine testing for mycotoxins is superior and unfortunately not covered by insurance company. It does help us move from guessing to targeting. And that's really the key of the testing. All right, back to how do you manage it? So what do you do? It's a multi-step. It's highly individualized because I'm definitely going to go to your gut and I'm going to get your gut to be healthy. So my whole plan, the first step is gut work. You want to get the gut and the detoxification pathways to they say open, but really I just want them to work. I want them to move forward. I want them to go from A to B. So you want the whole garbage system that's set up in your body to take something, convert it to something that is water soluble, and then send it to the second garbage center, which is the gut or the kidney. And then you want that gut to be able to conjugate it, convert it, and get rid of it and eliminate it, poop it out, right? We do not want it to recirculate it back into the body. So that's really the first part of the managing. And in this, 80% of your immune system is in the gut. So you're supporting the immune system in the gut. You're repairing the gut lining. You've got to remove the food sensitivities. And you also, if there's something in there like a pathogen, you really want to focus on the pathogen first. There's only certain cases where I'll do the mold first. It's very specific and individualized, and it really just depends on the patient's history, where they've been, what's going on. But there's usually a gut pathogen in there, and you want to really address the gut and the immune system in the gut first, right? You want that gut to be able to eliminate the mold and the immune system to be handle the mold when you start shaking it up and taking it out. So you really want that. It's a personalized, more individualized approach because each person's reports come back a bit different. Mold recovery can take time, but many patients experience amazing improvements when it's addressed. Before in closing with this, I must state here that you can't get anybody better if you don't eliminate the source of the mold. And it's kind of like a functional medicine, I guess, theory is you really can't get somebody better if you don't get down to the root cause. You can manage symptoms very well. Medicine is amazing at managing symptoms. A plus. But if you want to really get well, you've got to find the root cause of what's making you not well. Same idea here is if mold is there and we do the test and it comes out really high, I might not be shaking out the mold in your body at the moment, but we have to cut off the source of the mold. I can't get you better. I can't even get the gut better. So the first step really in all of this of managing you is finding the mold source, home or the work, and eliminating it. You have to do that. And that's why if it comes up, it's a bummer because it's work. You've got to eliminate the source of the mold. You have to find it. And I have tricks in the trades that so many of my patients have done, things that have worked. Again, doing the same thing over and over again, you get better and better at it because you're like, oh, okay, this worked, this didn't work. Oh, this family did this. Oh, this was cheaper. They did it this way instead of having someone come in. Okay. So, there's a lot to the mold remediation part too. But finding the mold, locating where the source is, and remediating that and getting rid of that. If it's work, we have to deal with your workplace, your boss, all this stuff. If it's your renting, I've written letters, we've gotten lawyers for people. It's not fun, but you've got to do the diligence and you've got to remove if you're the patient or if your child's the patient, you have got to remove them from the source. That's the first thing. Then we jump in and we do the gut work. And again, whether I jump to mold or I jump to the gut first, a parasite first or something like that is the way I set up your individualized system is specific to you, of course. It's not all the same. It's not cookie cutter. So in closing, mold is a serious, often overlooked contributor. I call it the driver. It drives a lot of chronic illnesses. If you've been struggling with unexplained symptoms, mold may be worth exploring. If you have a history of dancing with mold, you might want to consider this. What that means is, we did have a house with mold in it, and we did have problems with mold. Or my child did just go off to college and is living in a dorm that was built in the 1960s. We do have an air conditioning unit in the room. Things like that. If you know that there's a possibility of mold or you've dealt with it, you do want to consider it. When we listen to the patient's history, if they talk about mold or they have any kind of like inkling in it, we have to circle that. We have to highlight that and keep that in our mind. So talk with your healthcare practitioner or myself. You can definitely reach out to me, a functional medicine practitioner, about mold. And you can come to me about testing and what the next steps would be if I think that you have it. That's what my consultation is amazing, because we can dive deep into your whole history and we can see if this is something that you should be considering. But I thank you for listening. If this episode was helpful, please share it with someone who might need it. And I, of course, appreciate you listening and supporting me, and I will see you in the next episode.